Ellsworth County Medical Center, ECMC, and the Centers for Disease Control and Prevention, CDC, would like you to have the essential information you will need when caring for someone ill at home with COVID-19. Most people who get sick with COVID-19 will only have mild illness and should be able to recover at home. Care at home can also help stop the spread of COVID-19 and assist in protecting others at risk for becoming seriously ill from COVID-19. It's important to understand people with certain underlying medical conditions are more likely to develop serious complications with COVID-19, such as those with diabetes, lung disease, heart disease, all at any age, and also anyone above the age of 65. Helping prevent the spread of COVID-19 must be top priority for everyone. Keep in mind that COVID-19 spreads between people who are within 6 feet of each other through respiratory droplets produced when an infected person coughs, sneezes, or talks. Recent studies indicate that those with the virus but without symptoms could also be contagious for several days. This is why self-isolation and good hygiene practices are important to help stop COVID-19 spreading within the community. When caring for someone ill with COVID-19 at home, there are several things you can do to prevent the contamination of others. First of all, have the person stay in one room, away from other people in the home, including yourself, as much as possible. Have them use a separate bathroom if possible. Avoid sharing personal household items like clothes, dishes, towels, and bedding. Have them wear a cloth face covering that covers the nose and mouth when they're around other people, including you. And if the ill person can't wear a cloth face covering for any reason, you should wear one while in the same room with them. If the ill person needs to be around others at home or in a vehicle or the doctor's office, they should wear a cloth face covering, making sure that it covers the nose and the mouth. COVID-19 prevention and infection control measures everyone should be taking at this time are washing your hands often with soap and water for at least 20 seconds, especially after interacting with the sick person. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all the surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth. Every day, clean all surfaces that are touched often, like counters, tabletops, and doorknobs, using household cleaning sprays or wipes, according to the label instructions. Wash laundry thoroughly and often. If laundry is soiled, wear disposable gloves and keep the soiled items away from your body while laundering. Wash your hands immediately after removing gloves. Avoid having unnecessary visitors. Provide symptom treatment at home by making sure the sick person drinks a lot of fluids to stay hydrated and they rest at home. Give them over-the-counter medication to help with symptoms such as fever, cough, and sore throat, following the recommended instructions. It's understood that COVID-19 symptoms may appear from 2 days to 2 weeks after exposure to the virus. The most common symptoms include fever, cough, and shortness of breath. For most people, symptoms will last anywhere from a few days to a week. Then they will notice an improvement, but they must stay in isolation until they have met the following conditions. If they will not have a test to determine if they're still contagious, they can leave isolation after these three things have happened. They have had no fever for at least 72 hours. That's 3 full days of no fever without the use of medicine that reduces fever, such as Tylenol. And other symptoms have improved, such as when their cough or shortness of breath have improved. And at least 7 days have passed since their symptoms first appeared. If they will be tested to determine if they are still contagious, they can leave isolation after these three things have happened. They no longer have a fever without the use of medicine that reduces fevers, and other symptoms have improved. For example, when their cough or shortness of breath have improved. And they receive 2 negative tests in a row, 24 hours apart. Their doctor will then follow CDC guidelines. While caring for yourself or a family member at home, during this pandemic, you and your family should always be monitoring for any worsening symptoms. These could be warning signs to get medical attention immediately. Emergency warning signs to watch for include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. But keep in mind that this list is not all-inclusive. For any symptoms that are becoming more severe or concerning, please consult your medical provider immediately. Be prepared. Be sure to have your provider's contact information on hand. For medical emergencies, call 911 and notify the dispatch personnel that you or your family member are suspected to have COVID-19. This allows them to prepare important infection control measures prior to arrival. Understanding what to do when someone in your home has COVID-19 is important, not only to your family, but also for our community. Learning these steps and preparing will help you cope with this unique situation and possibly even make it less stressful. Watch this video as often as you like, or, if you wish, contact us at 785-472-3111 with any questions or concerns. ECMC is here to help you and your family stay healthy and safe.